Hello dear students, welcome back to your channel I Love Pharmacology. So in today's session let us learn about a very important topic that can be asked in your exams, that is anti-TNF inhibitors. These are the biological agents which are used in the treatment of inflammatory bowel disease. So you have got four monoclonal antibodies, four monoclonal anti-tumor necrosis factor inhibitors. So you can remember it as I cage. I stands for infliximab. C stands for certolizumab. A stands for adalimumab, and G stands for golimumab. So these are the four anti-TNF inhibitor that are used in the treatment of inflammatory bowel disease. So let us see the common reactions which are produced by these anti-TNF inhibitors. So basically, before going to this, let us see how it will going to act. So basically, this anti-TNF inhibitor will going to cause neutralization of the TNF which has been bound to macrophages, as well as the TNF which has been bound to activated T lymphocytes. So thereby it prevents the effect of the TNF on the effector cells. Apart from this, one should remember that infliximab is the chimeric Ig1 anti-TNF inhibitor, while adalimumab and golimumab is also the IgG1 anti-TNF inhibitor, whereas the certolizumab is the fusion compound where there is a attachment of Fab of chimeric anti-TNF inhibitor to polyethylene compound, so that its action is prolonged. So duration of action will be prolonged due to the attachment of Fab of chimeric anti-TNF inhibitor to the polyethylene compound. Apart from that, one should remember that the infliximab is administered through IV route, whereas adalimumab and golimumab is administered through subcutaneous route. So in common, those drugs which are administered through intravenous infusion, they are more prone for infusion related reactions. So this can be avoided by giving it through slow infusion. So along with that, you can add antihistaminics, while along with IV infusion you can add antihistaminics as well as the immunomodulators like the azathioprine or the methotrexate, so that you can avoid the infusion related reactions. So all of this anti-TNF inhibitors are known to cause a common side effects. The most common side effect will be the acute hepatotoxicity. It can cause acute severe hepatitis, acute severe hepatitis. So what you want to do after administration of these agent, regularly monitor the liver function test. Liver function test has to be regularly monitored. Apart from that, one should remember that these drugs are known to cause opportunistic infections. So this will increase the risk of opportunistic infections. It can be of tuberculosis. It can be of mycosis. Mycosis can be of histoplasmosis, coccidomycosis, candidiasis, etc. And also it can reactivate the viral infections, that is herpes simplex virus, herpes zoster virus, hepatitis B virus, etc. Apart from that, they are known to increase the risk of skin cancers, and also rarely they have increased the risk of non-Hodgkin's lymphoma. And also some of the cases have been reported with the optic neuritis. And also you should remember that there are chance of development of demyelinating diseases like multiple sclerosis. And also there is a chance of cardiac dysfunction can occur. Cardiac arrest or cardiac dysfunction can occur. So apart from that, one should remember that there will be formation of antibodies. Against these anti-TNF inhibitors. So these are high risk of 40% chance of developing antibodies with the infliximab. But slow infusion can reduce the risk of development of antibodies against these infliximab to 10%, whereas 5% is with the adalimumab and the golimumab, and 10% with the certolizumab. So this is the class on anti-TNF inhibitors. So you need to remember 4 drugs. So 4 drugs which are used in inflammatory bowel disease, which acts through inhibiting anti-TNF, is infliximab, certolizumab, adalimumab, and golimumab. So you can remember the mnemonic as I-CAGE. And you also saw which is the route of administration: IV, subcutaneous. If you are giving through IV route, IV infusion, there is a more chance of developing into IV infusion related reactions. This can be avoided by giving slow infusion. And most common side effect that can be encountered with all of these drugs is the acute severe hepatitis. So this drug needs to be monitored with regular LFT, and it can also increase the risk of opportunistic infections, risk of cancers, optic neuritis, cardiac dysfunction, etc. And also antibodies has been developed against these anti-TNF inhibitors. The maximum is with the infliximab. So if you find this video useful, please do subscribe to my channel, I Love Pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.